Hello, my name is Kendall Osborne, and I'm a family nurse practitioner student at Auburn University, and this is my 5-minute video presentation on Meniere's disease. Meniere's disease is a disorder of the inner ear that can cause dizzy spells, otherwise known as vertigo, and hearing loss. Usually it affects only one ear. It is considered a chronic condition, but there are medications available for symptom management. Meniere's disease can occur at any age, but usually symptoms begin between young and middle adulthood. And the exact cause of the disease is unknown, but symptoms result from excess fluid or endolymph in the inner ear. And here's a picture of what a normal ear looks like, and then the excess fluid that results in Meniere's disease. So what puts people at risk? The exact cause is unknown, but it is thought to be the result of abnormal fluid in the inner ear. Factors that may increase the risk for developing the disease include improper fluid drainage, possibly caused by a structural blockage or anatomic abnormality in the ear, an abnormal immune response, viral infection, genetic predisposition, or family history. It's thought that it's likely a combination of several of these factors that causes the disease. Some key questions to ask during the workup. What symptoms are you experiencing? Symptoms include recurring episodes of dizziness or vertigo, hearing loss that may come and go, a ringing in the ear, otherwise known as tinnitus, or a feeling of fullness or bulging in the ear. It's important to ask how often the symptoms are occurring and how long do they last. In order to make a diagnosis of Meniere's disease, there are certain criteria that must be met. And then, do you have previous ear problems or a family history of inner ear problems? During the exam, a thorough medical history will need to be taken to make the diagnosis of Meniere's disease. A diagnosis requires at least 2 episodes of vertigo, each episode lasting at least 20 minutes but no longer than 12 hours. Hearing loss that is verified by a hearing test, tinnitus or a feeling of fullness in the ear. And all other conditions must be ruled out in order to make a diagnosis of Meniere's disease. So a provider may order blood tests or imaging, such as an MRI, to rule out conditions that mimic symptoms of Meniere's disease, such as brain tumor or multiple sclerosis. Treatment. So there is no cure for Meniere's disease, and oftentimes hearing loss is irreversible, but there are several treatments to alleviate and lessen symptoms. Medications are available for the vertigo or dizziness. Usually motion sickness medications are used in this case, such as meclizine, Valium, or scopolamine. Medications that reduce nausea such as antiemetics, which would be promethazine, and medications to reduce excess fluid or diuretics. If symptoms do not respond to medication therapy, there are other options to consider, such as non-invasive therapies like rehab or a hearing aid, injections into the ear that may reduce the vertigo, such as steroids or gentamicin, and surgical interventions such as a labyrinthectomy or vestibular nerve section. Some patient teaching points. There are lifestyle changes that can be made to lessen the severity and improve symptoms. One can limit salt intake. Excess sodium can increase fluid retention. You'll want to limit caffeine, tobacco, and alcohol use, which can all affect the fluid balance. During an episode of vertigo, avoid triggers that may make episodes worse, like bright lights, television, or sudden movements. And vertigo can cause you to lose your balance, so the patient needs to be aware of their surroundings, don't push themselves, and ask for assistance to avoid falls or serious injury. And here are my references. Thank you for watching.